have a note to make before we begin today's international webinar. I would like to seek your cooperation in completing this international webinar. Kindly switch your mobile phones to silent mode to avoid interruption. Thank you for your kind cooperative and attention. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. It's my pleasure to welcome you to International Webinar, the Epidemiological Challenges of Non-Communicable Disease in the Future. The Honorable Professor Mariko Naito from Hiroshima University, the Honorable Dr. Candra Bumi from University of Jember, the Honorable Dr. Anita Dewi Prahastuti Sujoso, the Vice Dean for Academic Affairs, Faculty of Public Health, University of Jember, the Honorable the lecturers of Faculty of Public Health, University of Jember, and all beloved attendees. First of all, let's say thanks to Allah Subhanahu wa Ta'ala, who has been giving us guidance, happiness, healthy, and mercy, so we can attend and participate in this event without any obstacles. Ladies and gentlemen, before we begin this event, let's say Basmalah together. Bismillahirrahmanirrahim. On this special day, we have several agendas, so allow me to read several sequences of our agenda. The first is the opening. The second is singing Indonesia Raya Anthem and March of University of Jember. The third is welcoming speech. The fourth is presentation from the speakers and then discussion, and the last is the closing. Step on to the following agenda is singing Indonesia Raya Anthem and continue with March of University of Jember. For all attendees, to stand up please. attendees have to sit, please. The next agenda is welcoming speech. Because the Dean was unable to attend, for opening remark represented by the Vice Dean for Academic Affairs, Faculty of Public Health, University of Jember. Allow us to invite Dr. Anita Dewi Prahastuti Sujoso to deliver her remarks and continue for the opening of this event. Please welcome Dr. Anita Dewi Prahastuti Sujoso. Time is yours.
Bismillahirrahmanirrahim. Good afternoon, Dr. Chandra, Prof. Mariko. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Bu Septi Handaya, for as Master of Ceremony in this conference today. Praise be to Allah Subhanahu wa Ta'ala who have given His grace and guidance so we can attend the international webinar titled the Epidemiology Challenges of Non-Communicable Diseases in the Future. On the behalf of the Dean, I feel proud and grateful for Professor Mariko Naito and also Dr. Chandra's willingness to be the speaker today. We inform you that the Faculty of Public Health at the University of Jember has two undergraduate study programs, namely Public Health and Nutrition. We are concerned about the health status of the community, especially in agricultural community. We hope that for the next activity, we can collaborate in research, publication, and collaboration in order to improve the public health status of the National of Public Health status. Thank you.
Thank you, Dr. Anita, for the remarks and for the opening of this event. Ladies and gentlemen, before we get to the next agenda, let's get into the documentation session for a while. Please open the video. Okay. For the first slide, 1, 2, 3. And the next slide, 1, 2, 3. Yeah, thank you. Now we proceed to the seminar agenda. This presentation will be delivered by Professor Mariko Naito and Dr. Candra Bumi. This agenda will be guided by Dr. Anita Dewi Prahastuti Sujoso as the moderator. Before we go into the core of this event, I will read a brief curriculum vitae from our moderator today. Dr. Anita Dewi Prahastuti Sujoso obtained her bachelor's degree in public health science from Erlangga University in 2003. Master's degree in occupational safety and health from Gadjah Mada University in 2008. And doctorate degree in public health from Erlangga University in 2020. She is interested in research on occupational safety and health, and also industrial hygiene, and now she is the Vice Dean for Academic Affairs, Faculty of Public Health, University of Jember. Without further ado, allow us to invite Dr. Anita Dewi Prahastuti Sujoso to guide this session. Please welcome Dr. Anita. Time is yours.
Okay, well, thank you, Bu Septi Nur Rahmawati, as the moderator of this conference today. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. My name is Anita and I am the moderator of this conference. Welcome to the international webinar titled Epidemiological Challenges of the Communicable Diseases in the Future. In these seminars, we will have two speakers. For the first speakers, namely Professor Mariko Naito. Hello, Prof. Naito. Are you here? Hello, Professor Naito.
Okay, could you hear me?
Oh, yes, okay. Okay. And for second speaker is Dr. Candra Bumi. Hello, Dr. Candra Bumi.
Hello. Yes, I can hear you. Thank you.
Okay. Well, before we started for the conference, let me to introduce our first speaker. Professor Mariko Naito, Ph.D. is come from Hiroshima University. She has graduated from Ph.D. medicine from Nagoya University, and she also concerned about the epidemiology, quality of life, patient-reported outcomes, and oral health dysphagia. There are many publications that has been produced by Prof. Mariko Naito, and she also have many other publication and international publication like the effect of improving oral health literacy among teachers on the oral health condition of primary school children in Cambodia, and 2-year survey of oral hygiene condition of Cambodia public primary school and children. Prof. Mariko Naito, you have about 2 minutes for presentation your paper. Now, time is yours.
Okay, thank you for kind introduction. Okay, could you see my slides?
Screen
I think it's going to be.
So now I share my slides. Could you see my slides?
Yes, I have.
You have. Right?
Right.
Okay, so my title is Epidemiological Study regarding the association between oral health and general health. As you introduced me, and I'm dentist, and also I'm epidemiologist. Okay, so let me begin the story. The bi-directional association have been observed between oral disease and some systemic diseases, such as diabetes. It has also been reported that oral health is related to the risk of systemic diseases, such as heart disease, stroke, and so on. The following is mechanism of the association between oral health and systemic health. And the deterioration of oral condition caused by dental caries and periodontal disease leads to deterioration of muscularity function and nutritious intake status, which in turn lead to deterioration of systemic health and increased risk of disease, such as incidence of systemic diseases. Furthermore, it has been reported that while nutritious status also affects oral status, such as periodontal status. So Dr. Chandra sensei means the doctor in Japanese, and the Chandra sensei is going to talk about dental caries. So I'll introduce the periodontal literature of meta-analysis of CKD and stroke here. Yeah, well, okay, this is a meta-analysis with the association between the CKD and periodontitis. And in conclusion, moderate evidence for a positive association between periodontitis status and CKD, chronic kidney diseases. Evidence for the opposite direction is extremely weak based on significant heterogeneity between studies. And also one more article about the association between ischemic stroke and periodontitis. In conclusion, demonstrated an association between periodontitis, ischemic stroke. However, well-designed prospective studies should be carried out to provide robust evidence of the link between both diseases. This is an example for the association of them. Okay, so let's move to the dental caries and the dental status among Japanese. I'd like to explain just a little bit about Japanese situation. In recent years, the number of dental caries in children has been decreasing dramatically in Japan. In the 2016 survey, 90% of 3-year-old children surveyed were caries-free, no caries, dental caries. In the 2011 survey, okay, let's move to the for adults. In the 2011 survey, more than half of 70 and 74 years old had more than 20 teeth. It's quite a lot. The situation is better now. In the 2016 survey, I didn't show in this slide, but we updated. Half of 80 years old had 20 or more teeth now. Okay, this slide shows the causes of tooth loss among Japanese. The survey was conducted in 2018. And here are some data for the reasons for tooth loss. So periodontal disease and dental caries are the two major causes. In the Japanese data, the dental caries account for 30% of the causes of tooth loss now. Okay, so please look at the live picture. And the deterioration of oral condition also affects the state of care required. So we have the 3 components. The prevention of malnutrition for prevention for requiring long-term care. Second, improvement of oral function. Lastly, prevention of sarcopenia. Okay, so please look at the first one, the second one. So this one, they are related to the oral health. So we take care of them for a dental professional. Actually, oral function has many components, such as chewing, swallowing, speaking, breathing, and sometimes smiling, and a kind of expression. And it is important to maintain the oral function, I believe that. And you can see the live picture, and also you can imagine that kind of oral condition, and it's quite problematic, sorry, it has a big problem because the quality of life decreasing quality of life, and it is difficult to have the eating or speaking or social problem. Then let's move to our study. And today, time is limited, so that's why I'd like to introduce our research briefly. So Cohort Study in Japan. So aim to examine the effect of oral health on the general health. And study subject, more than 20,000 Japanese dentists. Method, there at baseline, the self-administered questionnaire and follow-up for health outcome. Then follow-up more than 15 years. So I'd like to show this the result. And tooth loss and incidence of systemic diseases. You can see the stroke and heart diseases. Here, the stroke. We have the good result. the association between oral status and incidence of stroke, and the group with 0 to 9 tooth loss group, and compare with 10 and 19 tooth loss or 20 to 28 tooth loss. Then much more tooth loss group had much more risk, higher risk of having stroke. But for heart diseases, we didn't have any significant differences. And here, there's tooth loss and hip fracture, sorry. And the risk of hip fracture was significantly increased 5-fold for those with 15 to 97 teeth and 6-fold for those with 28 missing teeth compared to those with 0 to 14 teeth. The association was even stronger when the analysis was restricted to subject over 60 years old. And also tooth loss and the mortality from pneumonia, and compare the much more tooth loss. And increased risk of the death from the pneumonia as like double, 2 times higher risk. And I believe this is the last result of in this presentation of our cohort study. So oral health rated quality of life and mortality. And this is a study on oral health quality of life and death. Higher quality of life score indicates a better quality of life. Having a lower oral health rated quality of life was associated with mortality for men, but not women. So here is a summary. Several studies indicated a positive association between general health and oral health. 30% of tooth loss due to dental caries in Japan. According to the result from a large-scale cohort study in Japan, tooth loss increased the risk of stroke, death from pneumonia, and hip fracture. Having lower oral health rated quality of life was associated with mortality for men. Okay, so here's our study results. So lastly, we'd like to introduce our lab and our school. So Department of Oral Epidemiology, Hiroshima University. Okay. We belong to School of Dentistry, and we have education in social dentistry and oral hygiene, and clinical practice at Hiroshima University Hospital. And our major is epidemiological research. So I'm epidemiologist. Okay. So we belong to 4-year dental hygienist training course. So here is the graduation ceremony picture. So this is our student who have their research for the graduation of undergraduate education. Sorry, it's so difficult to explain for me, but it's so nice and a beautiful kimono weird. So the Hiroshima University pay attention to international activity. But here, so Taiwan, Australia, South Korea. Okay. And we have various forms of exchange programs, such as short-term training and graduate school enrollment. So, and actually, so left picture, upper left, she graduated the Ph.D. course. She is Taiwanese and she got license in dental hygienist of Japan too. And also we started a new program, online program last year. And we started South Korea and Taiwan, and we'd like to develop this program. And we have wonderful time with Chandra Sensei. This time we appreciate that. And also today, it's honor to have such a presentation here. And we look forward to see again. And also we'd like to have a good program and collaborate each other in the near future. Okay, thank you for your attention.
Thank you for your presentation. It's precious presentation from Prof. Naito. Okay, for the next presenter, we are going to have and here the presentation from Dr. Candra Bumi. Dr. Candra Bumi, you will have about 30 minutes to present your paper. And then after all of the presenter complete finishly, we are going to have a discussion session. Dr. Candra Bumi, time is yours.
Yes, thank you for coming here, and good afternoon, konnichiwa. I know about a little Japanese, konnichiwa, arigato gozaimasu, ohayo gozaimasu, marimasu. And thank you for my colleagues at Jember University for coming, and maybe some students join with us. Hide. You can hide. More. Hide. You see, hide. You can see more and hide this. This is hide.
Oh, okay.
Yes, it's okay. First of all, I want to thank you for Professor Mariko Naito for accepting me at the Hiroshima University and hospitality. And I have a lot of knowledge around I came to Hiroshima University. And this presentation is idea before I came to Japanese, and then the idea is so involved me because I saw the culture of Japanese, and then I can have my concept about epidemiology, non-communicable disease. I think it's a new concept. There's nothing before. The objective of this presentation is analyzing the concept of epidemiology non-communicable disease, maybe new concept, and then determine appropriate prevention and of non-communicable disease, how we can prevent prevention of non-communicable disease at the new era. I think we know that epidemiology has two separate knowledge about descriptive and analytic, and as we can show the coronary disease maybe, for example, we can see descriptive is prevalence by the disease, men more than women or another. And analytic, we talk about risk factor such as alcohol, smoking, sedentary life, genetics, and etc. We know that communicable disease and non-communicable disease is different because communicable disease can transmit it. But we saw that right now, I think that non-communicable disease can transmit it too. So we can, right now we can different between non-communicable disease and communicable disease. Both of them can transmit it. Usually I use the term not transmitted, but spreading. Because if I use transmitted, is we think about infectious disease, but spreading is more common than infectious disease. So non-communicable disease is non-infectious disease, but we can transmit it to question mark. I talk about spreading. Why is it important? We saw that non-communicable disease kill about 41 million people each year, and 74% of all deaths globally. And 77% are in low and middle income country like Indonesia. And the major non-communicable disease is cardiovascular disease and cancer, diabetes, respiratory disease, and the main risk factor is unhealthy, sedentary life, smoking, alcohol, and physical inactivity. There's 4 major causing non-communicable disease. What is the risk factor? We separate 2 kinds of risk factor. The first is modifiable behavior. We can change the behavior of the people. First is about tobacco, smoking, about 8 million deaths per year. And I'm actually surprised when I'm coming to Japan because I think the Japanese is not smoking. Yes, but I'm coming to Japan. I saw some people smoking too. there's a surprise me. And number 2 is physical inactivity, about 30,000 deaths per year. And I think the Japanese people have a lot of physical activity, not like in Indonesia people, and unhealthy diet. So I came from food culture. There's so many unhealthy diet in Indonesia, like a sweet diet and sodium diet, very salty people in Indonesia. And we like to eat some chips, crackers, or fried food. There's so many unhealthy diet in Indonesia. So if I saw the common people at Indonesia, we so many people suffer from obesity, maybe about 40% or 50%. If we look around, it's different. If I saw at Japanese people, there's so few people getting obesity. And the last problem is alcohol. 1.5 million deaths per year. I think the Japanese is the problem too, because I saw alcohol everywhere in Japanese. But it's different alcohol with Indonesian country. Indonesian drink about kind of alcohol is methanol, and Japanese is ethanol alcohol. It is a different alcohol. And the second risk factor is metabolic risk factor. It's rise blood pressure, overweight, hyperglycemia, hyperlipidemia. As we know about metabolic syndrome, there's the 4th factor of metabolic syndrome. Socio-economic impact can become non-communicable disease. I think the major problem is poverty at the developing country. So the poverty, we have limited access to health service, and household cost is there's no money to household costs. So there's problem non-communicable disease in developing country. The first problem about non-communicable disease is cardiovascular disease. We saw that cardiovascular disease is the number one. Green one, okay. Is cardiovascular disease, ischemic heart disease, and followed by stroke, and HIV is number 3. Is a presented problem in low and middle country. There is the number 1 program in Indonesia in non-communicable disease. We got the program is Posbindu. Is the first program. We know that non-communicable disease can caused by infection. I saw some sample. Dengue can increasing risk factor of stroke, because we know that dengue virus can destroy, can damage endothel from blood, and the second is cancer, cervical cancer, caused by HPV virus, human papilloma virus, and diabetes can trigger by virus too. There's number diabetes type 1, and S mutant can trigger stroke. Yes, previous explanation from Professor Mariko Naito before presentation about streptococcus or oral health can trigger stroke. So I saw that there's interaction between non-communicable disease and communicable disease. Communicable disease can become non-communicable because sequel infection disease. For example, heart disease can trypanosoma cruzi, streptococcus can become heart disease. We know that pharyngitis, S mutant, beta, yes, S mutant, streptococcus beta hemolyticus, yeah, can become pharyngitis, and endotoxin can destroy some of mitral valve at the heart. So heart disease became severe. And the second, asthma. We saw that asthma can caused by helminth and dust mite. I have a friend at the Surabaya. He suffered asthma because of helminth, Ascaris lumbricoides. We know about Lafleur syndrome. Then the larva swallowed and entered to the lung and became asthma. And chronic pulmonary disease. Yes, even tuberculosis was cured, but the sequel infection can become chronic pulmonary disease because tuberculosis destroyed the parenchyma of the lung. So even tuberculosis can cure, but sequel of infection tuberculosis can become chronic pulmonary disease. And the second one is non-communicable disease will trigger communicable disease. This is direct problem, direct cause. Increase of immunocompetent of host, yeah. Yes, or decrease of immune system of the host. Yes, so if the immune system of the host is decreased, so the host will susceptible infection problem. And tuberculosis and diabetes mellitus is there is a relationship between tuberculosis and diabetes mellitus. tuberculosis, if we get suffer diabetes mellitus too, and then we can how to cure that disease, because the immune system will decrease caused by diabetes mellitus. And the third is COVID-19. We saw that comorbid of COVID-19 is non-communicable disease too, especially diabetes, asthma, heart disease, and so on. And the third, identification of common risk factor is more important. Like tobacco is risk factor for both non-communicable disease and communicable disease. There's, for example, the common risk factor. Yes, the slide shows that diabetes can decrease all the immune system. That's important thing. So cellular immune system and humoral immune system can decrease, and then we can easily to get infection disease. This is vice versa. That the viral infection can become diabetes mellitus type 2 or type 1. And viral infection can destroy the pancreas cell, pancreatitis, and reduce beta cell function and become diabetes. Or viral infection can activation the immune system, and the immune system secrete some cytokine, and cytokine there's a liver and muscle became insulin resistant, so the diabetes mellitus happen. There is a new concept I propose today about the major risk factor, as I talked before, certain life, tobacco, alcohol, and unhealthy food can spreading by the psychosocial, cultural, ethnic, socioeconomic attribute of population and local communities. This the most important we have to think if we want to prevent the non-communicable disease, because this factor can spreading major risk factor. So many people getting ill caused by non-communicable disease. This, for example, how risk factor can spreading. On the food source, yes, I have some experience in Japan. There is my weight is decreased about 6 kilograms at a month because I'm not happy in Japan, but because I googling that the calorie of the rice from Japan is lower than Indonesian rice. So we have, if we develop the food source at Indonesia, Japan rice, we go to Indonesian and we plant in Indonesian, maybe we can decrease the non-communicable disease at Indonesia food. It's by technology. And climate change, like right now in Japan, I feel cold right now, very cold, and I don't think Japan is very cold. I don't imagine before. And the cold of the cold weather can increase metabolism in my body. So my body can burn fat more than if I go to Indonesia. And the most important is demographic culture. And ABC Japanese is inspiration for me to research at Indonesia. Japanese culture is healthy diet and physical activity is good. Like not in Indonesia, if I want to go to just short of market about 300 meters, I usually use motorcycle to go there. There's a different culture in between Indonesia and Japan. So maybe 3 months in Japan, I'm more healthier. Yes, we have to develop our culture, healthy culture. Maybe I think about the parking, the motorcycle park. Maybe we can put away from the building, so we force the student or the people walk to the university. We have to force it. So we build some culture here, and maybe migration, genetic admixture, and I know some Indonesian people and Japanese people married, and we have a genetic admixture, maybe good or bad, I don't know. We can research about that, about Japanese and another married with another country. So my conclusion is non-communicable diseases are non-transmitted but can spread. It is, I think, a new concept. And non-communicable disease can be caused by sequel infection, infectious disease, and several risk factors. We know about before from Professor Mariko Naito presentation. Oral health can become general health disease, infection or non-infection disease. And I want to know how oral health became malnutrition, what the pathogenesis oral health become malnutrition. And it is necessary to identify risk factor both, for example, tobacco and non-communicable disease and communicable disease have a mutual influence. So we can separate non-communicable disease and communicable disease. We can just call a community disease. Maybe someday we can separate the both of them. And non-communicable disease prevention should not only control this factor, but also factor that can spread non-communicable disease. This is I came from Jember, white one. This is Jember, and surrounding by mountain is Bali, more famous than Jember. Maybe Japanese knows about Bali Island. Yes, in this Jember, there's a Pelengkung beach. We can surfing here. There's one of the best wave for surfing at Indonesian. There's a location, the Pelengkung beach, Desember. This is Ijen crater. We can see blue fire here. There's blue fire at the night. There is two kinds of blue fire in the world. First one is from Ethiopia, and the second one is in Indonesia. Blue crater is right here. Yes. There's Bromo. We can see view of several mountains and sunrise right here. There is Bromo. It's near Jember. If you sometime go to the Jember, I can. There's Jember University. It's my faculty, agro-coastal community, the priority of public health in my faculty. That's mine and my student, and just student of epidemiology, not whole of. It's a lot student faculty of public health. That's my specialization about how to prevent of infective disease. Thank you. Arigatou gozaimasu.
Yeah, okay. Well, we just finished it, that all of the presenter just have completely finished their presentation. From the Professor Naito, we can learn that the public health status not only influenced by any factor that we know today. For example, could be influenced by administration policy, epidemiological, genetic. But now from Professor Naito, we can learn that public health status could be influenced by dentist status. And from Dr. Candra, this is an interesting topic that we can learn today. We know that the epidemiological can be divided into communicable diseases and non-communicable diseases. But today, Dr. Candra will say that all of two of kind of the epidemiology can be influenced others by others. Yeah. Now we are going to have a discussion session. I think we are have to in the audience on the auditorium and audience in the Zoom meeting. For the audience who will have a question, raise your hands, and the audience in the Zoom, you can write the question on the chat room. Is there any question? Is it so clearly the presentation from Dr. Candra and also Prof. Naito? Yes, the question could be delivered in not also in English but also in Bahasa.
Oh, yeah. Okay, so. 何か質問
One question from auditorium is from Bu Irma.
Saya menggunakan pakai bahasa Indonesia ya.
Okay.
Pertanyaan kepada Bu Profesor Mariko, bagaimanakah program dalam penanganan oral health dan malnutrisi di Jepang? Apakah itu sudah menurunkan penyakit non-communicable disease yang ada di situ? Terus untuk yang Dr. Candra, pertanyaannya adalah bagaimanakah nanti dalam new konsep di non-communicable disease ini dalam bentuk diimplementasikannya di program di public health. Terima kasih.
Pertanyaan yang pertama. First question is from to Professor Naito.
Yes.
Yes.
Okay.
Okay. Prof. Naito, are you hear the question from the audience?
Yeah.
But not understand.
Yeah, sorry, could you repeat? I couldn't hear clearly, so that's why. Please explain. Yeah. Sorry.
Yes, you can. I think you can answer for the first question. The question is
Yes,
how
yeah, please.
how is the program in the Japan could be decrease to decrease the communicable diseases in Japan?
Okay, decrease the non-communicable diseases, right? Such as diabetes or stroke and heart diseases and cancer, as like that. Is that all right?
Yes.
Yes. Okay. Okay. So we try to have conduct a prevention program to decrease cancer, such as we will have the screening in community much more, and also screening is the first. And also, we will have we try to have the health promotion to prevent cancer and heart diseases and stroke for all Japanese. And but that depends on the community. So that's why we have the differences in the municipality in Japan. This is a problem. But anyhow, we try to have the challenge to prevent and decrease the non-communicable diseases. Can I ask you a question? Is that all right?
It's okay.
How is the answer, Bu Irma? Okay, I think it's enough, Prof. Naito. Thank you. How about the question to Pak Chandra?
Okay, I want to repeat the question so the Japanese audience can understand how my idea become planning at Jember or Indonesian. I think we can change the culture at Jember or at Indonesian by force or another media. Maybe we can change the culture with technology or another media. I think if we look at Jember University, if we park some motorcycle, it's near the building. So we have to change about that. Maybe we can place park cycle or car as far from building, so we can force the student or lecturer walking, so we can become health. And the second, maybe we can build some building and in the high place, so we have to walk upstairs, and we force to go to that building, so we can healthier. And another program we can apply for that reason. Thank you, Bu Irma, for the question.
How about the answer, Bu Irma? Is this clear?
Thank you. It's clear.
Okay. In the Zoom, I see there is a question. Is for 4 minutes. Question number 1. I think it is for Prof. Naito. What are the barriers to preventing non-communicable diseases in Japan? And question number 2 is for Pak Chandra. Is doing health promotion enough to tackle non-communicable diseases?
Okay, thank you for your question. It is very important and it is an essential issue in Japan. Actually, this is my opinion, and it is difficult to reach the target population which we need to involve to prevent the diseases, such as maybe the fragile population or the lower social economic status population, or lower knowledge of healthy information. Such situation is very important to intervene the health promotion. However, we cannot reach that kind of population. I think this is a barrier to access to them, and also the go forward to prevent diseases. I think this is a big barrier in Japan, but not only in Japan too. Is that all right? To answer your question?
Yes, I think this prevention for avoiding the communicable diseases is the similar in any countries, isn't it, Prof. Naito? And we also can do health promotion to prevent how to tackling the communicable diseases in our country.
Yeah. Thank you.
Okay, we still have the second question in the Zoom from Pak Dewa. The question for Prof. Mariko Naito. Can you give us an example community surveys that have been done by Hiroshima University or Japan government for promoting oral hygiene or preventing oral problem, especially for public health, I think.
Example. Okay, so take a minute. Can I see the chat? And by Hiroshima University Japan government hygiene implement, especially for community service. The example. Well, for example, the the community services, and Japan has a well-done system to the health center in the municipality, such as in a city or a town, or sometimes in the prefecture. So that kind of health center conduct the program, health promotion program, and other health issues involve health issues. I think this is one example. And also oral hygiene, promoting oral hygiene. This is a very good question for us. And preventing oral problem. Well, and also the health center are conducting the oral health program too, such as the screening program and having the advice for mother and child, but not any clinical treatment. This is a different issue. This is a dental practitioner issue, so that's why it is not related. But anyhow, the health program will be conducted in the health center in a city and town and prefecture in each municipality. Okay, so okay.
I see. Prof. Naito, could you please explain once again? I mean that would it be if is still Japan have any problems about the oral hygienes?
Hygiene, the problem?
Yes.
Well, we have problem.
To have
Is the Japan have any problem about the oral hygiene and promoting about oral hygiene?
Yeah, of course we have. We have many
how
problems.
the Japanese deal with that.
Deal with them.
Yes.
Yeah.
Them or promoting how.
Promoting, yes, promoting. promoting and promoting, promoting. And also, yes, and well, and also promoting is very important thing, and also the professional, not only dental professional, any all kind of health professional need to consider about oral health status. So that's why we try to disseminate information to other health professional too, not only patient, not only community. I think this is one example. But to solve the oral health issue, oral hygiene issue, and for example, in the nursing home or hospital, and in the home, at home, and many kind of situation will be needed to solve to oral health problem. And oral hygiene is important to maintain the general health. So that's why right now we try to disseminate this kind of information and promote such kind of thing. But maybe 20 years ago, we didn't care so much about that. And now many Japanese remain the case, even though they're 60, 70, 80 years old. It's nice and wonderful, but for example, they are bedridden or they stay at nursing home. It is difficult to take care of them because they have many teeth, but they cannot take care by themselves. So somebody needs to take care of them. So it's lead to the problem of oral hygiene too.
I see. I see. So from your research, we can learn that oral status or oral hygiene or what is it? From dentist status can be one of the predictor of public health status, isn't it, Prof. Naito?
Yes. I can explain too. A couple days ago, I came to a health facility that care elderly people at Hiroshima with Bumi Sensei, and I saw the promoting the health program about physical exercise, and we can examine the oral health too, and diagnosis, and we train how the take care about oral health at that facility. There's more elderly people in Japan, not Indonesia, and they are alone at home, so they need to take care at a center or the health facility.
Yes, okay. Thank you, Prof. Marito and Dr. Chandra. I think we have a little bit time before we finish our session discussion. How about if we try to answer one question again, Prof. Marito and Dr. Chandra?
Maybe we can ask audience here.
Oh yeah.
Yes, for the question.
Are there an audience in Japan?
Yes. There's
Okay. Please ask the question by raise your hand in the button Zoom. Oh.
Okay. We have the one question and from the Professor Ota in Hiroshima University.
Thank you for the presentation, Mariko Sensei and Chandra Sensei. And so I'm happy. I have participated in webinar seminar. Thank you very much. So I have a question to Chandra Sensei. So some Japanese investigator reports the relationship between oral bacteria and also non-communicable disease such as diabetes and also do you think the relationship the bacteria and non-communicable disease, and what do you hope in the future? What type of bacteria?
Okay, thank you for your question. Can I already answer?
Yes, yes.
Okay. Thank you, Professor, for your answer. Arigatou gozaimasu. And my focus, I think, about the oral health and S mutant, because there is so many problem child carriers in Indonesia. Maybe a different cause carriers in Japan and Indonesia, but there is so many carriers in Indonesia, child in Indonesia, and some research correlation between oral health and stunting and disorder of the growth of the child. And I want to focus about that, about how the mechanism of oral health can be stunting in Indonesia. Thank you.
Very much. So Japanese researchers, so sometimes research association with this and surgical mutants.
Yes, yes.
The kind so you keep research data, so and so we get international context. Thank you.
Thank you. Okay. Is any question in Indonesian?
Yes, I think one question in the auditorium. Please.
Okay, hello, can you hear me?
Yes, yes.
So this is the question for Professor Mariko Naito, and for especially from the part where the oral disease caused by the chewing, and I cannot help but thinking that there's a lot of people that talk about the more you chew, the better. Then from your perspective of the oral disease itself, does it have that great impact? The word of the more you chew, the better. That's all.
There's the paradigm more chewable, more better. Is it correct?
More sugar.
Yeah, it's more better.
More better means the health.
Yeah,
Okay, yeah, thank you for a great question. And yes, and I think some papers show the good relationship of your saying. That means the better chewing is better health. But I believe the evidence is not so strong right now because the studies are limited. So we need much more studies in the future. But yes, we believe the better chewing is better health. And actually, we cannot conduct the RCT, randomized control trial, in that theme. So that's why we have some cohort study and cross-sectional study.
Maybe how about rubber candy? Do you know rubber candy? Chewable candy? Yes.
Candy. And
Rubber from rubber.
what?
Rubber. We cannot swallow it, but we can chew it.
Chewing.
Yeah.
Yes, yeah.
It's
yes.
more better.
Yes. Maybe, but we don't have any strict product.
Okay.
We are not sure about it, but maybe it would be useful. Okay. Is it all right? Can I answer your question?
Yeah, thank you for the great answer, Professor.
Thank you.
This is undergraduate student.
Really, it's wonderful. We are so happy.
Other graduation student from Public Health Faculty. Okay, Dr. Chandra and Prof. Naito, is still time to have one question, maybe?
Yes, yes.
We have 10 minutes left. I think.
I think just 5 minutes.
Okay. Okay, ladies and gentlemen, is there any question for all? One question maybe? Yeah, one question, yeah. Only one question. Please directly to ask the question to Prof. Maito or Dr. Chandra.
So I want to ask to Professor Mariko Naito. Hello, Professor.
Oh,
Good afternoon.
Konnichiwa, konnichiwa.
Konnichiwa, Professor.
konnichiwa.
So I want to ask you, in your presentation, you told us about tooth loss and incident of systemic disease, and one of them is stroke. I want to ask you about how can tooth loss can affect the stroke and how the systematic of tooth loss became a stroke. Thank you.
Okay, thank you. Great, great question. So, I don't think I explain fluently here, but briefly, I'd like to explain. I think this is a cause of inflammation. The inflammation continues because people has the periodontitis and caries, dental caries. That means that we will have the long inflammation. And that may cause to the stroke or other non-communicable diseases. We believe that. And stroke is one big example. And also heart disease too. But in our study, we couldn't see the clear association between the tooth loss and oral status and the heart diseases. But other studies indicated the association between heart disease and oral status. And that means especially periodontal disease has long continuing inflammation. And that goes to the instance of the diseases.
Okay, thank you, Professor, for your answer.
Can I answer too?
Yes, please, Dr. Chandra. Yes,
Yes,
please.
I'm discussing with Nomura Sensei. He is a specialist of S mutant. S mutant and is one of causing caries. And he explained that S mutant have several strain. There is different strain as different produce of some protein. We call CNM protein, and the CNM protein can integrate with integrin in the blood system, vascular, can destroy the vascular, and stroke can happen. There is explaining from Nomura Sensei. Thank you.
Thank you, Dr. Chandra, for the answer also.
Okay, I think 50 minutes to 3, and we have going to end to the session of discussion today. Before we are, I'm so sorry for the participant or for the attendee that's not cannot be delivered the question. I think. And I hope that for the next time we will meet Professor Maito and Dr. Chandra for the in other seminars. Before ending the meeting, please I can conclude a few points for the seminar today. The condition of healthy teeth and mouth will be affect the nutrient intakes, and good nutrition will have an impact for the health status. From the Dr. Chandra, we can conclude that there is a new from the epidemiological for the future. The non-communicable diseases and communicable diseases is not really divided, but it will be can influence each other. I think that non-communicable diseases can be communicable diseases, and non-communicable diseases can be also communicable diseases, and many factors that triggering it. Okay, thank you for joining on this meeting. I will be back to Master of Ceremony, Bu Septi Nur Rahmawati. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you so much, Dr. Anita. And before we close this event, allow us to invite Professor Takimoto to deliver the closing remark. Please welcome Professor Takimoto. Time is yours.
This is my face. Thank you very much for very amazing and useful presentation, Dr. Chandra and Professor Naito. And also, thank you very much for everybody for participating in this meeting. Thanks to you, we have had a very active discussion and very get the knowledge, new knowledge from you. And also I've been informed that there is a very good place for surfing in Indonesia, but unfortunately I cannot swim at all. But about the volcano, I have a very much interest, and so if there is opportunity, I want to visit there. And but unfortunately, Dr. Chandra is going to leave Japan. It's a pity. I myself have a very few opportunity to communicate with you, but even though I can, I impressed that you are very polite and also very good person. And after coming back to your country, please let us to have a communicate keep on communicating. And also in the future, if possible, we want to do collaboration with you. And at last, I want to tell from our wishes of your good health and also future making success and in after coming here back to your country. Thank you very much.
Thank you, Professor Takimoto, for the closing remark. Before we close this seminar, we would like to appreciate for the speakers today, Professor Mariko Naito and Dr. Candra Bumi, and also for moderator, Dr. Anita. Yeah. We thank you very much for participating in this event. Ladies and gentlemen, we finally come to the end of today's agenda. Let us close the international webinar by reciting Hamdalah together. Alhamdulillahirobbilalamin. Okay. Those are the agendas we have presented to you all today. From the deepest of my heart, I do apologize for my mistakes in presenting this event. Okay. Don't forget to fill out the evaluation form to get the certificate. The link has been sent on the chat Zoom or can be seen on the screen. Thank you so much for your attention. See you on the next event. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. Thank you, Anita.
Thank you, Prof. Naito. Nice to see you.